Alrighty. Pleasant good evening to everybody. Again, my name is Michael Brower. I am an attorney at Disability Rights New Jersey. I'm going to be the background host for this evening's virtual town hall. Tonight we are convening the DD community in the time of COVID-19 as part one of a four-part series of reopening and reimagining. And tonight we're going to be talking about reopening adult programs, supports, and services. Just to remind you, and a couple of housekeeping things we'll take care of right off the bat. You're coming into the Zoom on mute from our administrator. Please keep your microphones on mute and your cameras off. That helps us cut down on chatter and clutter. We're recording the session, so that also helps us have a nice clean recording. For those of us who couldn't join at this time, they can come back, listen in later, get all the information, and not get too much background noise. I want to make sure everybody, if you don't already know about it, Disability Rights New Jersey has a website dedicated to COVID-19 responses, hot topics, issues, summaries of different kind of advocacy efforts that we've undertaken. That's drnj-covid.org. Take a look there for facts and take a look there for recordings on prior town hall sessions for both the DD community, the mental health community, children, and pretty much anything else that DRNJ has done that addresses the COVID-19 crisis. I want to introduce our DD partners, starting with Mercedes Witowski, Executive Director at the New Jersey Council on Developmental Disabilities. You'll be hearing quite a bit from her later on, so I'm going to save that for now. From the Boggs Center on Developmental Disabilities, we've got Colleen McLaughlin. She's the Associate Director there. Again, you'll be hearing from her a little bit later on during the main presentation. Deborah Spitalnik, also from the Boggs Center on Developmental Disabilities, may be joining us. The participant list is rather long, so I didn't catch her coming in or not. We have special guests that have been joining us for all of our DD partner town halls. Paul Aronson and Christine Bachter from the Office of the Ombudsman for Individuals with Intellectual or Developmental Disabilities and their families, a great connection to the state government and a great resource. From Disability Rights New Jersey, we have Gwen Orlowski, our Executive Director, along with myself, and several of my colleagues from DRNJ are joining us on the call. And if any questions come up during the question and answer session, I would encourage all of my DRNJ colleagues to jump in if you want to take a spin at an answer or if you have a thought or a response. We do want to, now that I mentioned Q&A, I want to make sure that this is a dialogue. We want to make sure we hear from you. The best and easiest way, if you're on a computer or on a phone with access to chat, the chat window is built into Zoom. If you don't see it on the little black toolbar, there's 3 dots that say more. You click on that and a drawer will open and you'll see the chat. That's the best way. We ask if you have any questions, any thoughts, if you want to share resources with each other while you're participating in the Zoom tonight. That's where the best place to do it would be. If you don't have access to the chat window, the next best thing is to email questions@drnj.org. We just learned that you can actually text questions to questions@drnj.org from your SMS-enabled smartphone or even a regular phone. Data messaging rates may apply. Tonight, we're going to be focusing on reopening concerns, like I said. To lead that conversation, I'm going to reintroduce Mercedes Witowski from the New Jersey Council on Developmental Disabilities. Mercedes?
Thank you, Michael, and thank you everyone for joining tonight. We're happy to be in your living room, kitchen, or whatever space you've decided to listen in and watch this webinar tonight. As I got through the end of the day today, our house is very musical. We use a lot of musical references, and a song just kept ringing in my ears, and the song is Mama Said There'd Be Days Like This. There'd be days like this, my mama said. And I think that I'm not sure what your mama or my mama were thinking when that song was written, but boy, these days have really been eye-opening, challenging. We've had great moments. We've had terrifying moments. So where this town hall series is taking us now is we had a very harsh shutdown of our state's systems for those loved ones with disabilities in our lives and for individuals with disabilities, providers, the whole system back in March. And we've now begun these conversations about reopening. We are seeing our governor make announcements about things reopening, excitement of maybe getting your hair done, or now even today going to a mall. But what does this mean for our loved ones? What does it mean for individuals with disabilities? What are the things that we need to articulate? What's on our minds? What are our concerns? So we really wanted to use this opportunity to start or to continue, I should say, that dialogue. So if you could go to the next slide, Michael. Since we've been in these conversations, the New Jersey Council on Developmental Disabilities has reached out to our listservs and said, tell us what you're thinking about reopening and your concerns. I'm going to share a few of them real quickly with you, but while I'm sharing these, I'm going to again encourage you to drop a note in the chat if you're not on the Zoom call itself. Use those methods that Michael mentioned, questions@drnj.org, or by text or email. So do that and think about doing that as I move quickly through this so that we can engage with you. That's the most important thing of tonight's call, is to really help you identify issues that you have or hear the issues that you're already concerned about. So, some of the things that had come up right away was, will an individual with disabilities be able to tolerate a cloth mask, a mask covering, and maybe for how long? For a short ride in a car, or for a whole, a whole day at a day program? What are the concerns about tolerating mask wearing? And other factors that would need to be taken into consideration around transportation and the systems that many of us hear about and know that our children, we ourselves, are engaged in on a daily basis. How will the state and day program providers really determine what people's individual needs are and their risks are associated with returning to some of the typical programs, day programs, jobs, supported employment opportunities? And how will, if a family member decides not to send their child back to a day program, an individual decides not to go back to a day program or a job, what's the risk of losing that spot, that day program spot, or the job that the person has? Next slide, Michael. Some of the other things that we've heard are, if a day program, and as day programs look to reopen, will they have a limit on the number of people that will return? Will they be monitoring the risks and taking daily attendance, and what kind of practices will they have when people arrive and as people move throughout the day? Will day programs offer remote services? Some are already offering some remote services. Will day programs offer in-home services if there's too much risk associated with return, and people have been waiting for something to start up again? If they're in a day program, where will people eat their lunch? How will they move about the program and remain safe? Concerns about, will the staff that come in and out of the day program work exclusively in that setting, or will they hold other jobs like we know many direct support professionals do? So next slide, Michael. So those are some of the concerns that we heard. And then we got, we had individuals, families write to us. And I really want to thank everybody for doing that, because it really helped inform us. But we also heard concerns that also had recommendations within them. So there were lots of recommendations, really good recommendations around protocols, policies, practices around sanitation, screening workers and individuals that are coming in and out of programs, and community, how community and outdoor activities are going to be managed, and protocols, ideas around that, ideas around social distancing, and for programs that have limited space, how to ensure that there's sufficient space. How testing going to play into this? What are the protocols around transportation? Lots of protocols would need to be established for safety in that area as well. Next slide, Michael. Also, prioritizing who might return. The there is no date. There are no dates for when any day programs or any activities will open where people can go in person. So if something reopens and it reopens slowly, how will that program, how will that individual be prioritized within the early phase of reopening to full reopening? Will there be flexibilities in the system? And there were recommendations about staggering arrival and departure times, having schedules that would allow for smaller groups at varied times in the day. Again, offering in-person and remote services where that can be managed. And then one suggestion in particular struck out is that, we don't always think about our hygiene and our sanitation and what's important in this environment. So it was a suggestion of maybe there should be a daily hygiene and sanitation training that everyone participates in, staff and individuals. So those were the reopening concerns and recommendations that we heard very early on. So if you can go to the next slide, Michael. DDD announced a reopening work group just a couple weeks ago, and they've convened this work group to discuss reopening of congregate day programs and other areas within DDD services. The first meeting was on June 4th, and the group is charged to develop recommendations and guidelines that can be used by individuals, families, and agencies to inform around reopening. Next slide, Michael. There's 5 phases of the reopening recommendation guidelines that the division is looking at. One is the now, where we are today. Day programs remain closed at the moment. And there is no date for a reopening. So what guidance can be provided to ensure that people have meaningful engagement in their homes or in their own homes with their families, wherever they are? What's the kinds of things that can be going on now, and recommendations from this committee and guidelines around things that people can be embracing now? Next slide, Michael. And then recommendations in the second phase around pre-opening, what the division calls pre-opening. How can families and agencies prepare for the reopening of a congregate day setting? What are some things that families and individuals need to consider in returning to what was happening pre-COVID, I'll say? And then for agencies, what would need to be done to have the proper screening and sanitation and other social distancing and transportation protocols that would need to be put in place? So a lot to unpack. And in the next slide, Michael, there are recommendations that will come out regarding how to ramp up. So this is not a flip the switch scenario. Things closed very quickly and we turn the light switch off, but there will be a slow ramp up before moving to full capacity. So what will this look like? What milestones would need to be achieved in order to get to that next phase of reopening? Next slide. The fifth phase, the final phase then, is if there's a return of the virus, which, as we listen to these media reports, we hear that there will be another wave, there's likely to be another wave. What adjustments would need to be made? What can be done to ramp down attendance? If there are hotspots, maybe more geographically aligned. What are the ways we communicate with people? And what are the lessons that we learned from the closure process that can inform any ramp down that might need to take place? Also got a couple additional concerns in today. Concerns about the regression that individuals feel their loved ones have encountered during this, and the irreversible damage that some people were really fearing during these last 3 months. So, and the other concern that didn't make this list was a very real concern about individuals who have not been able to visit with their families or loved ones since the state issued guidance to restrict visitors at congregate living, at group homes, at supervised apartment programs. So if you were real busy getting your dinner and figuring out setting up your night before this call and didn't get a chance to check your email, please know that the division did issue guidance about 20 minutes before this call on residential providers on visits with families and friends. So it was issued today to go into effect on June 21st. So I haven't even gotten a chance to read through it as we were preparing for tonight, but please check your email. It should be now up on the DDD website if you're not on DDD communication today, which I would seriously suggest that you register for that communication. And I see that, thank you, Paul. He just posted the link to that visitor guidance in the chat. So with that, I am going to, if you go to the next slide, Michael, I'm going to sorry, not ready for that yet. I would like to just tell you who's on the reopening work group. There are 5 service providers, one from each of the trade organizations. So Laura Williams is representing the ARC of New Jersey, as the ARC of Ocean County Executive Director. They run facility-based programs as well as community day hab. They also run supported employment in home services, residential, and they're a support coordination agency. Representing the ABCD, the Alliance for the Betterment of Citizens with Disabilities, that trade organization is Svetlana Ripakira. She's with Community Options, and they also run facility-based and community-based day services, in-home services, residential, and a program for medically fragile individuals. Joanna Miller, she's representing the New Jersey Association of Community Providers. She's with the Department for Persons with Disabilities. They run day services, facility-based, residential, and support coordination. And then 2 organizations that only run day services, and that's so no residential component, and that's David Mock with Primetime Centers and Reggie Neal with the United Cerebral Palsy of Hudson County. Next slide, Michael. And then there are 5 advocates on the panel of the work group members: Margaret Gilbride with the Bog Center, Eileen Hurley, who's a family member and chair of the Family Advisory Council and the statewide regional family support planning councils, Carolyn Hayer, who's a family member and on a host of councils, including the Family Advisory Council. She's on the State Rehab Council. She's works at SPAN, New Jersey, and she is a board member of DRNJ and the ARC of New Jersey. Renee Pierce is a self-advocate who receives services from an impacted agency, and myself. I'm also represented on this 10-person work group with the Division of Developmental Disabilities. So I know I moved through that as quickly as I could, because we really want to hear from our panel tonight. We've assembled 3 individuals that we would like you to hear directly from, so continue your chat. I'm going to be looking at that as our first panelist. If you go to the next slide, Michael. Steve Grzlovic is a self-advocate, and he is going to share his perspective on reopening with us tonight. Steve, good to have you.
Hi, thank you everyone for inviting me to this panel. This was a picture of me, with a lot less hair and no beard, because I haven't been out of my house in approximately 3 months to even go to a barber. So, I'm very concerned with the potential reopening, and I'm actually kind of concerned that they're going to do it too fast for the state. I know everybody wants to have it be open and go out to places, but if we do it too fast, there's an increased risk of having the virus come back and spike. And with our population, we can't take that chance. A lot of us are high risk and too vulnerable. So I would just like them to open it up slowly and cautiously. I'm also concerned with the opening of day rehabilitation centers, that the staff are going to come back to work, and because they have to work 3 and 4 jobs, they're going to be exposed to a lot more people, so therefore they could be asymptomatic and spread it. Myself personally, I try to keep my house as independent as possible with very few people coming in, just to limit the risk. But it's all about what risk you're comfortable with. And as we see new information come out, um, then people should be able to make individual choices and decisions as to what they would like to do for themselves or their family member.
Thanks, Steve. So some of the folks are chatting about, do we have the answers? And Steve, I think you would agree, none of us really tonight have the answers. What we're identifying are the concerns. Do you have any suggestions about ways that reopening might be effective? I know you said it should be, slow and very cautious, but any ways that you think about how we can be informed about reopening and what might, in your opinion, what might make the most sense?
Well, if we limit the capacity and stagger the schedules, that might be a way. If we increase cleaning for the facilities, that might be a way. But I honestly, with what comes out in the media every day, even Dr. Fauci, the head of the immunology and infectious diseases unit, he said himself he's not even sure, with a lot of the stuff that's going on, what's going to happen. So I think as long as we are careful and we understand that we are a vulnerable population and that we need to be extremely cautious. I think when we first open up, I think there's going to be a big rush for everybody to come out, like they did with some of the beaches and other social establishments. I mean, they just opened outdoor dining on Monday. I haven't been to outdoor dining yet. I probably won't go for another, week or two just to let everything settle down. But I think overall it's about personal choice and what type of risk you're comfortable with.
Okay. Thanks for that, Steve. So if you have any specific questions to Steve, please put them up in the chat. But I'm looking at a couple other questions here and see that there's a question about virtual programming. Will that be allowed to continue, the remote programming? And again, DDD has not issued any guidance on reopening of day programs. I've heard on the DDD sessions that are held now every other week that there's no end date to stopping the remote services. At some point, that we'll have the proper time to plan for that. I'm seeing some questions about whether or not there are real answers and what's being discussed. So on June 4th, I mentioned the first reopening committee meeting took place. Originally it was scheduled for one meeting a week, but they've doubled that and have had some subcommittees continuing to meet. So I can share that a lot of the concerns and the suggestions that have been raised that I see coming through the chat and that we've seen directly at the council have been part of those conversations. There is no date when a final report will be issued, but the group is scheduled to meet through July 2nd. So I would hope shortly thereafter, we would begin to see some of these, the division would begin to issue some of its policies around this. So thank you, Steve. Is there anything, Michael, did you pick up anything in the chat that we might want to pass along to get some reaction from Steve?
So I think we've got something that came in through questions@drnj.org. And remember, you can email or text that from an SMS enabled phone. And there's a series of questions that came in, and I kind of distilled a few down to questions about folks with NJCAT or tiering issues. And Steve had mentioned, it's up to everyone's individual kind of determination what risk they're willing to accept. And I wonder, maybe Steve, you could address this a little bit as a person who, uses services, what that kind of an impact, having a flexible budget or being kind of tied to a budget might impact your ability to, go at your own pace and do something and take risks at a pace that you feel comfortable with.
Part of the issue is I know a lot of people are going through reassessments at this point. I'm scheduled to go through a reassessment soon with my new budget level, and my health concerns have gotten a little bit worse. But overall, I think it is very difficult. You know, you always have to have a plan A, plan B, and plan C. And I think it's very difficult during this pandemic to have backups to the backup, because you never know if somebody's going to get sick, or if you need. Right now, I'm in the process of hiring people, and I've had to completely adjust my hiring process to go completely virtual. Usually, I do everything individually and meet people out in public, but I've had to do a lot of Zoom meetings over the last week to hire staff for myself. And the process with the paperwork to get people hired in order to take care of me, it's extensive, and there have been many delays. So I think it's very difficult for individuals with disabilities to hire people within the current system. And how do you you know, find 3 backup people when, you know, a lot of times people don't want to even come out to work due to the virus. You know, so I think that's getting increasingly more difficult as time goes on.
Thanks, Steve. You know, you're getting lots of thumbs up in the chat. People totally agreeing with your slow and steady approach, and I'm sure agreeing with the challenges around hiring direct support staff. So Steve's still going to be on the line, so feel free to send more questions his way. But next up, I'm going to introduce Yolanda Smith to you. Yolanda is a family advocate who's going to share her perspective. She's a Family Support Planning Council member in Essex County Council 4, and she's the mother of Antonia. So Yolanda, we're real curious to hear your thoughts about reopening.
I tend to agree with Steve on some of the issues that we're concerned with. Antonia went to program up until it closed, and her last outing was going to the movies. And she really enjoys activities like that. And I don't see, you know, letting her go to outings or out into the community anytime soon. So yesterday, had you asked me, would Antonia be going back to program soon when they open? I would have said yes. Today, all the articles I read, all the you know, talk that's out today, because it seems to change from day to day. Today, she will not be going back right away. It's been a challenge, you know, having her at home, but it's been a blessing to be able to be her DSP. For parents to be able to be a DSP is really, it's really a blessing to not have to, you know, depend on someone coming into the house and you know, right now we need to keep to ourselves and stay quarantined. And so I don't see where I'm going to let her go back anytime soon until the guidance come out, until we have some sort of solution of keeping our families safe at day programs, at, you know, community outings, at jobs.
So Yolanda, you brought up about how you've become your daughter's DSP, and you know, early on in the pandemic, the Division of Developmental Disabilities did issue a policy change where previously parents, guardians, and spouses could not be a self-directed employee as a self-hire. So I do see a question in the chat about, you know, will the policy allow parents, spouse, and guardians to continue to be workers? What do you think about that, Yolanda, after the pandemic?
I think that it should be, it should remain in place. First of all, we don't know how long we're going to be open, when we're going to close. We don't even know, you know, what the future is going to hold. But to be able to be your child's DSP as a parent or a spouse, oh my gosh, what's happening with my TV? What's happening with my screen?
We can still hear you, Yolanda.
Okay, great, great. Okay. Yeah, so I think it's a good thing, even though I am right now through Gold Medal Home Health. I applied through PPL before that, and it's still not complete. So I like to just throw a little plug in there that PPL is not on the ball with getting your process right away.
Mm.
Back.
Thanks for sharing that. And so you were able to get hired through an agency first, Gold Medal Home Health, and became your daughter's worker, but you're still trying for that self-directed option. So I think that this is going to require advocacy. The Family Support Planning Council and the DD Council has advocated well before COVID that the division allow parent, spouse, and guardians as is allowed in the PPP program. For all of you, and there's quite a number of you on the call tonight, if that's something that you support, this would be a good time to send a message to the state and encouraging that. I also saw a specific question about testing. What do you think about testing, Yolanda?
Okay, so testing, I think that it's key. It's going to be key for this, to get back started, that everyone be tested, because there's no visible sign. There's no, you could be asymptomatic, and we really, and our children are vulnerable and with their health. And I just see that testing is going to be key for everyone,
So, we don't have, a plan in current residential settings for universal testing throughout the centers. Developmental centers had universal testing throughout their developmental centers, the 5 developmental centers and their staff. That has not been the case in the community. And I'm already seeing some questions come up in the chat about, well, what about vaccinations when there is a vaccine? So those are questions that probably are good to have now, because so much of this has just hit us by storm. Anything else you'd like to share, Yolanda, before we move on to the next perspective?
Well, other than saying, I saw a video that Paul tweeted out earlier today about a family who their child was in a group home, and one family went and got their child and brought him home to be with the family, and another one let him stay in the group home, and they haven't been able to see them in 3 months. So those kind of things are really, those are, sad and tragic that, our lives have been disrupted like that. And some people can understand like what's going on, why we need to, keep mask on and that kind of stuff, and washing your hands. Then some of our population doesn't understand at all. They don't know. They're not gonna be aware of wearing the mask, cleaning their hands, and they need someone, hands-on with them all day long. So that's another issue that I would have with, returning to program right now. Yeah.
Thank you, Yolanda. Really appreciate your perspective. So while we go to the next slide, and I'll introduce Amy Watts. There, like as of 7:30, I'm trying to get, that was like 3 minutes ago. There's 63 new messages in the chat. So this is incredible. We really appreciate your chat. We have a way to preserve the chat. So I doubt that we're going to be able to get through all of the chat. I know people are helping each other on the chat. We love that too. If somebody would put up the link to the DHS COVID website where all of the DD recordings are stored, as well as all the policies that we're talking about, or either talked about or some that we haven't even addressed tonight. Please make sure that you have access to those. If you're a provider who's posted a couple of chat questions, there is a dedicated email address that you can send those questions to. We probably are not going to be able to get to a lot of your questions in the chat, but we'll continue to try to feed as many of your comments in. And we're glad that you're chatting with us. We're glad that you're participating. So Amy is a support coordinator with Neighbors Inc. and really thought it was very important to hear from Amy and the role of support coordination in this process that really impacts and affects every one of our children's lives. We all, almost all, I'll say, have a support coordinator involved. So Amy, we're real curious and anxious to hear about your reopening thoughts and concerns.
Thank you so much for having me. And well, that build up, I don't know, now I'm a little worried. So the one thing I can advise from a support coordinator perspective is now is the time to have some really deep conversations. If you are very concerned about your loved one, your son or daughter, or yourself returning to a day program, that is 100% understandable. I'm a parent myself, and I absolutely understand the concerns you have and thinking about returning my kids to school. So I absolutely have some very similar concerns, and I'm hearing the same concerns from the families that I support, as well as that you guys have kind of been bringing up, and it's statewide concerns. So this is absolutely the time to have some conversations with your support coordinator. There are lots of other types of activities and things that your loved ones could be doing. I absolutely understand that staff can be unreliable, and that if they are uncomfortable coming, then you don't have a staff in your home to kind of cover when maybe you need to go back to work. I do hear those concerns. You can, as a parent, as others, as Yolanda said quite frankly, that you can get hired either as an SDE or a self-directed employee through PPL, which is not always the grandest of adventures. I absolutely admit and understand that. I'm in the middle of it with a family myself. Company hires can be quicker, but they do cost more from your budget. So that's, again, why you have a conversation with your support coordinator. If it's something that the budget can afford, even if it's short term during this COVID period, and it helps you financially, it helps the family out, it helps to kind of cover what you need to cover, then absolutely it's something that's possible, and your coordinator should be doing that for you. Your coordinator should also be asking some probing questions as, hey, can your loved one wear a mask? Is that something he's comfortable with? Is that something you're comfortable having him wearing? Are there some alternatives that you can wear, sort of those face shields? Or I have a gentleman that wears a helmet because he has some significant seizures when he goes out. So we're talking about putting some plastic over the helmet that he's already used to wearing to kind of provide some more coverage and protection for him. So it's time to get creative. It's time to look at, hey, maybe my loved one shouldn't be going, or it's not safe for my loved one to go back to program 5 days a week. What if we can find something for 2 days a week, and so he's not there that often? Things along those lines. So there's some great community providers. I love when we start up new ones. I think community providers are great because they are literally in our own towns, and they're the people that we see when we food shop and we go to places. So I think to cultivate that and to really kind of have some deeper conversations on where your loved one's medical and your fears and concerns are. So let's see what else we can put in place. And day programs are great, and they're very, very good for a certain sect of people. They're not the best for everybody, and I think this kind of forces us to be a little bit more creative. Give us a call. Our support coordinators are here to work with you to make that happen.
Well, we appreciate that more than ever now, Amy. If the role of support coordinators was a tall order before COVID, it certainly is breakfast, lunch, and dinner all combined. So we need support coordinators to help guide that process. And you should still be hearing from your support coordinator, even though they are not visiting in person. They are still conducting calls on a monthly basis. So make sure that you bring your questions to your support coordinator. They may very well have answers, or will use their network to get answers. Any other thoughts, Amy? I didn't see anything specific in the chat about support coordination, but
yeah, I'm glancing at units and costs, and yes, you absolutely do need to, because what DDD will not do will add an increase to your budget no matter what it is that you're doing. They will only add an increase to your budget if you have a change in support needs that is sort of life-altering. So even in this pandemic time, they're not increasing budgets just because you need staffing supports versus something else. So your coordinator, and you need to work really, really closely and kind of watching that. But we can do this. I have hope and confidence that we can do this. There's lots of great ways to kind of nip and tuck and shift and move. We can pull funding from the program because they're not using it. We can utilize that money and shift it towards services you need to use right now. Even if we broadcast things, we can always pull it back. So there's always revisions that can be done and things that can be altered to try to help match what you need. But now is the time to kind of think more creatively overall, for sure.
Mm-hmm. So thank you, Amy. That's a really good segue then. So I'm going to introduce and pass the rest of this along to Colleen McLaughlin at the Boggs Center. She's the Associate Director at the Boggs Center, and she has some things to share about that rethinking and reshaping that you're talking about, Amy. So take it away, Colleen.
Thank you, ladies. And thanks, Amy and Yolanda and Steve. We appreciate your thoughts and everyone's questions that are coming in. So we at the Boggs Center, together with the New Jersey Council on Developmental Disabilities, have been working with the Division on Developmental Disabilities relatively recently on the implementation of Charting the Life Course framework and participation in the National Community of Practice. I know, and I'm seeing some names of many people on this Zoom today that are familiar with some of these efforts and some of these tools really aimed at helping people to vision what their lives can look like and what needs to be put into place in order for those lives to be realized. And the vision really for use of these tools and concepts in New Jersey is for people with disabilities and their families to be empowered to communicate their vision for a good life, and for professionals and systems to ask the questions, listen, and act on strategies to help reach that vision. And that's really what we want to get started talking here about, is the sense that, well, it's a challenging situation and it's a devastating situation for everyone, the COVID pandemic. Oftentimes turmoil brings opportunity for change, and turmoil brings opportunity for us to innovate differently, and it's an opportunity to really communicate what people want and need, and it can be just a revitalization of supports and services. So if we want to go to the next slide. This here is what we refer to as the life course trajectory. And the goal in anyone's life, disability or not, is to achieve what their good life is and have less of what they don't want. And this time right now that we're confronted with can be seen as an opportunity. And it's a time for us to really get back to the roots of person-centered planning and get back to the roots of, first and foremost, starting with identifying what people want in their lives, what their preferences are, and what that good life is going to look like, and communicate that to the systems and service providers and anybody else who is touching the lives of your family members, in order to say, this is the life we want to achieve. How are we going to reinvent things now to help them achieve that? So what we're hoping is looking at this as an opportunity. And in order to get some input from people, in addition to a lot of the questions that are coming through, which I think are very informative in terms of reopening and what people's concerns are and how that's going to look like, we want to be able to capture, what do you envision, what do you as a person with a disability, what do you as a family member of a person with a disability vision for that good life? Services aside, what are services going to help the person to achieve? So Michael, if you wouldn't mind, flip into the first set of questions. The chat box is actually a good mechanism for us to be able to capture all of this information very easily. So what I'm going to ask you all to do is, we have almost 150 people on this, so it's a great way to capture a lot of information, is what do people want in their lives that's going to help a person have a good life? What are those things that make a good life happen? And I'm talking about, what are those things that bring enjoyment, that bring meaning, and supports the person to contribute to their communities. And so I'm going to ask everyone to type that into the chat box, and I'll sort of transcribe as things come in. But we want to capture that, so the services can be created in a way to help people meet these things. So everyone can find the chat and chat what people want present, what brings enjoyment. So I'm just going to read off some of them so everyone can see. paid work, family contact without supervision. If you're thinking of rehabilitation providers, what are the things that you want them to do? We saw a bunch of questions in here that talked about, can day program providers provide supports elsewhere? What does that look like? Because you know what? The sky's the limit, and the home and community-based services settings rule actually says that they should be. So what does that look like? My daughter wants to live in her apartment, supervised housing. Community outings with social distancing. So what do some of those outings look like? What are some of the things that you want to encourage your providers to be able to do? Outdoor activities, going to the pool, feeling useful. So these are the things that we want to dig deeper in. So as Amy said, when you're having conversations with your supports coordinator, when you're thinking of those things like outdoor activities and feeling useful, what does that mean? What helps the person feel useful? What helps the person? What are the things out in the outdoors that they like to be able to do? Because that's the information that needs to be communicated up to the providers to say, hey, we want to do more of this. How can you make that happen? Going out to work and socializing. Transportation that's easy to get so people can go out with their friends. It's huge. Visiting places that were frequented before things are shut down. Just going back to your old life. Building social capital. Returning to jobs that have meaning. Absolutely. Keep typing these things in. Being with friends. Going to stores, restaurants, socializing, great. Being together with peers near her apartment. People, great. People that know her and care and protect. And everything being done safely. Getting out. Absolutely. And these are all conversations that people should be having with their supports coordinators. So that information can be built into the plan. So the service providers and other supports can figure out how all of these things can be accomplished. And that information can be really helpful to the reopening work group as things are being considered in terms of what does reopening look like and how can things be reinvented along with that. Mercedes, do you have anything you'd like to add or questions you'd like to ask?
So I would just like to say that, you know, when we've listened to families about reopening, and this is the dialogue tonight, you know, what are your concerns? What are your recommendations? What are your thoughts? What we're hearing is that some people have been able to manage through this reopening by, you know, being creative and coming up with opportunities for themselves and their loved ones. Others have done absolutely nothing. And the day program providers that I've talked to have said they're really concerned about the people that have done absolutely nothing in the last 3 months. And if they can't go back to the day program for whatever reasons, medical reasons, and other challenges, they can't continue to do nothing. So, you know, Colleen, in bringing this part forward in this talk tonight is to try to help some of those folks and help each other come up with the ideas and the ways that can bring enjoyment and meaning, even if we stay in a relatively slow, steady place toward reopening. There's no light switches being flipped here. Again, I'll say that again. We need to do this in a planful way that keeps, as I see in the chat, that keeps people safe. Go ahead, I'll take it back to you, Colleen.
Oh no, I think one of the things that seems to be interesting here is I see a lot of things popping up about making sure the person has control, and it's the person that's guiding his or her own life and making sure their preferences are known. I'm also seeing some things about, actually there's a few people that have commented on whether or not the availability of some of these remote services in terms of Zooms and technologically based services will still be available. And if we look at other states, there are actually other states that have been making these types of supports and services available for years in terms of helping people to be more independent and having more remote support options by using technology. And I think we've had just a little sliver of experience with that over the past 3 months. but there have been many people that have been successful with it. There's been some people where it's been challenging, but we need to look at that and really analyze where have the successes been and what do people like about that and may want to keep, and maybe even expand in different ways, and what didn't really work and how can we potentially make that better? Because there have been other states that have shown, actually in Mercedes, I think you guys had the summit a while ago about that, like that have shown like you can use technology to help people increase their independence and become more included in their communities in different ways. So I think that's just some cool feedback.
Colleen, we're also seeing that, you know, I see it in the chat and I've heard it almost every day that, you know, virtual and remote options just don't work for some people either.
Mm-hmm.
So then we need to have a different layer of conversation and creativity around, you know, still, you know, what makes, you know, I look at my daughter, like what makes her happy, and singing makes her happy. So she's singing every single day through this, even though she's not going out, she's doing the thing that makes her happy. And I've supported everything around that, including getting her own Zoom account that makes her happy. So if virtual doesn't work for your loved one, then what are the things that brings them enjoyment? What do you see that makes them happy? And then how do you build upon that?
Absolutely. So we're gonna move on to the next question. And you know, oftentimes it's a lot easier for people to envision what they don't want. And then by looking at what they don't want will help you to figure out what people do want. So what has been preventing, if you look back to before COVID, what are the things that might have been preventing those good lives, all of those things that people do to contribute, being with their friends, that prevent that from happening? And what do you want to make sure is avoided as systems and organizations reinvent themselves in the face of reopening? So what do you envision, what don't you want to happen? And you can type that in the chat again, because that's where we want to be able to collect this information. So what don't you want to see happen? What do you want to avoid? One size fits all solutions. Absolutely want to get back to the roots of person-centeredness.
So while people are typing that in, Colleen, a couple other questions. You know, what happens to the budget? You know, do people lose their budget while they have been, you know, out of the services that they had pre-COVID? And really, you know, it's going to depend on when your budget cycle comes up. So when your annual plan ends and the new one starts. So any money that was in the budget as of the date of service, that plan ending, would not be accessible. The new budget period would start, you know, and then that funding would be available. There's also a question about any plan for the date for the soft opening. And I can just say, being on the reopening committee, there is no date being discussed at this point. It's the mechanics and the considerations for safe openings, slow openings, and all the considerations around them: transportation, physical plant, needs and risks of each individual that are being discussed right now in that reopen group. There is no date. So I'll let you go back to some of the new chat and the what prevents a good life from happening.
Great. Yeah, a lot of it is still a lot of concerns, you know, just in terms of safety and risk. And I think the other thing that's I think the thing that's really coming up in a few cases is that whole concept of transportation. In general, we know that across the state that's always been an issue and a challenge for people. So that could be an important thing to consider with reopening is how do we want to look at transportation differently? Are there new opportunities around transportation in terms of helping people to be able to do what they want to do to get their good life, and not necessarily just transportation from one place, you know, from home to day program, but maybe how does transportation work beyond that as well? Transferring is huge. And it's interesting because I see someone like, there's some people that be willing to provide transportation. So tapping into different resources if transportation turns out to be an issue. I think the other concern and what people don't want is for people to be left vulnerable or in situations where they have to decide between going to their job because they have to go back to work or taking care of a loved one. because people are going to have to go back to work at some point in time. And if there's not a support or service available to help them to do that, that's going to be a challenge. So that's something really important that people need to look at. And I think one of the things that there's only 5 minutes left, and I know we're not going to have a ton of time to talk about the next question. And I think it actually leads us in to next week in terms of really envisioning and thinking about what is going to help people to get to their good life is for people to take this and I don't know the tool. We can get the tool to people, and actually I can go online and probably find the tool. And if Rebecca's on, if she can put the tool in the chat box, that would be awesome. But one of the things that people could start to do is take this and work with their support coordinator and have the conversations about what does that good life look like, because your supports coordinator knows so much about the different supports and services that are available and the ways in which they can be crafted and sort of melded together to meet the family systems needs. And also provide that information to the providers so that the providers are providing supports in the way that the person wants to be supported. And I think that that's a really important thing for people to be aware of, is that support, that individualized service plan and person-centered planning tool that people work so hard on with their supports coordinators is meant to guide the supports and services. It's not the other way around. It's not necessarily supposed to be a provider saying, this is what we provide, you take it. It's supposed to be, oh, we provide this type of service, and we need to provide this type of service in the ways that are going to meet your needs and are going to meet your goals. And we need to know information about you as a person to be able to provide that service in the way that's going to be most effective. And this is a great opportunity to be able to communicate that information to providers to help them shape how they're going to reopen and shape how they could provide and reinvent supports and services moving forward. And Amy, I don't know, do you want to add anything to that? Because you're on the front lines all the time.
Yeah, exactly. No, that's absolutely true, especially to the providers, because they have the opportunity now to sort of reinvent the way they operate. So if there is a particular community location that makes lots of sense for your loved one to be at, then absolutely speak to your day program provider about utilizing some of that space. So there's no reason why a day program why day habilitation needs to be done in a building. There's no reason for that. So we are trying to charge and to challenge day program providers as well to think about what else they can be doing and how they can be doing it in different locations. I've worked with some that have been really, really creative. One guy took one program where they took this small group of guys, and they were in a library. They were in like the upstairs area of a library kind of for lots of days. And another one volunteered at a church. And so they used one of the classrooms that they used for CCD. They used it during the week for kind of program space. So there's lots of ways to kind of branch out, do these small group things, which we all know this social distancing is absolutely key to everyone being safe. So if you speak to your programs and say, look, my daughter, my son could come back if they're able to do this, if you can design this, let them know what your feelings are. Absolutely. Keep talking and keep offering suggestions. If they're smart, they'll listen.
So go ahead, Mercedes.
I was just going to say, this has been a great conversation. I'm going to put a plug in for the 10 regional family support planning councils. If you go to njcdd.org and you're not already connected with your local family support planning council, again, people have really stepped up on this. Once they figured out what they needed to do in their own homes, many families, as peer supports, are ready, willing, and available to lend to your thoughts, your conversations, giving you opportunity to share concerns. So I'd encourage you to do that. We'll look at the chat and make sure that we kind of try to get to a lot of what you've asked. But Michael, do you have some final wrap up for us tonight? I know we're at the top of the hour.
Yeah, we're running just about a minute left on the clock. I want to really thank all of you guys who did a fantastic job. I've got a ton of information. Everybody in the chat, super active. It's one of the most active chats we've ever had on one of our town halls. It makes me happy to see everyone's really engaged. This session is being recorded, and the slide deck along with the video and audio recording will be available on the ATAC New Jersey YouTube channel. ATAC is associated with Disability Rights New Jersey. We'll make sure we also put a link up on our drnj-covid.org page. That way you can click right through to find it, along with some of the other archived town halls. If you have some questions about kind of the process going forward, this is really section 1 of 4 on the reimagining process here. The next one will be on June 25th, also at 7 p.m. The next one after that, July 9th. And then our last of the 4-part series will be on July 16th. The registration links can all be found. The website is up on your screen. I'm not going to bother to read that all out. It'll just make no sense. If you continue to have questions between now and then, feel free to continue sending things into questions@drnj.org. Like Mercedes said, we try to keep an eye on those, and if we can find answers, if we can tailor our presentation to meet your needs a little bit more, we want to make sure that we're doing that. With that, we are officially 1 minute over the clock. So I want to once again thank you, Mercedes, our panelists, and all the partners and all the participants here. It's really been fantastic. And with that, we're going to close the recording and say goodnight.